Health officials are sounding the alarm on the increase in respiratory illnesses across the country. COVID, RSV, and flu cases are on the rise. Jen Sullivan reports on what the CDC is saying about the health threat.
Respiratory illnesses are on the rise across the country, and health officials are concerned.
RSV season is in full swing.
While COVID cases are nowhere near the winter surge we've seen in previous years, the numbers are going up. And cases typically spike during the holiday season, which is exactly what happened last year.
COVID is still the primary cause of new respiratory hospitalizations and deaths.
The CDC says every week 1,000 people are still dying from COVID and 15,000 are hospitalized. And respiratory virus cases in children are rising, with RSV being the key driver of hospitalizations for this group.
It's one thing to see a rise in these types of infections, particularly in school-aged children, but also to monitor the severity.
The number of cases is putting a strain on some pediatric hospitals. The CDC says 70% of beds in children's hospitals are being used. Capacity hasn't been this strained since mid-December last year. But respiratory illness is not just impacting the U.S.
We are seeing, in general, an increase in respiratory infections around the world.
Northern China and Beijing are seeing a surge in children with respiratory illnesses. The CDC and World Health Organization are monitoring the situation closely.
We're following up through our clinical networks and working with clinicians in China to better understand resistance to antibiotics.
The good news is that it doesn't seem to be a new pathogen causing the spike in cases. Health officials warn the best protection against respiratory illness is for everyone to get vaccinated. I'm Jen Sullivan reporting.